Hi, welcome. My name is Lauri Groh, and I'm the owner of Shoreside Therapies. And today we have Lauri Budzynski with us. And Laurie has been a therapist for us for a while now. You think it's maybe
Yeah,
like three?
3 yeah, I think I've been at Shoreside for 3 years.
Yes.
Yeah, yeah,
Yes, and it's been amazing. And I'm
yes,
so very excited to talk with you today.
yeah,
And I think it's going to be a really good conversation too, because I think a lot of people are going to be very curious when you talk about some of the clients you see today. So,
yeah.
yeah.
Thank you, I'm excited.
Yeah. So I want to hear, and I think a lot of people would want to hear your general philosophy and
Mhm,
how you do counseling and kind of start with that. And then I want to hear a little bit of the clients you see.
yeah. So I have been a therapist for, goodness, I think 9 years now, and but I've been here at Shoreside for 3, and I think, as we grow as clinicians, right, we learn things about ourselves and who we really love working with, as well as just as we learn new techniques and ideas, it kind of changes like what we do and how we work with clients. And so I have just absolutely fallen in love with family work and kids. So I really love working with kids, really primarily under 12 and their families. And so that has been my main area. Yeah, so I think my focus is like I want to help you be the best version of yourself and the best version of your family, right? Because I think everyone's interactions with each other affect how we do. I know, even in my family, like we affect how we are with each other. And so
Yes.
when one person, right, comes in with behavior challenges, for example, that's a big one that I see, right? As kids come in, there's, hard to soothe, really big meltdowns, tantrums, really high anxiety, lots of things that oftentimes it's part of their environment. So it's not that someone's doing something wrong. It's just maybe we don't know or aren't aware of that, that keeps kind of feeding in and making it really hard for the child to regulate. And so that's where I found it really beneficial, bringing families in. So something that, as I've just grown as a clinician, I wanted to kind of further my experience working with younger kids. And so I did last summer, I graduated with a infant and early childhood mental health, like degree. And so I love working with like the 0 to 6. That's really what that age range focuses on. And really, it's like, what do you do with a 0 or 2-year-old? Is that too early for therapy? And we're learning that so much happens with brain development, attachment, connections, how a child regulates in the world that they're in, right? Their environment. So whether it's at the playground, at preschool, in their home, at grandma's house, at the store, at a restaurant, that those environments, how a baby is adapting to those actually shows how a child will grow up and be.
Yeah. Yeah.
And
I love
so,
that.
yeah, it's so cool. And yeah, I think there's so many kids I see when they're 7, 8, 9, and they're like, when I look back at their history or talk with the parents about their history, it's like, well, when they were 2, I was noticing this.
Yeah.
And so that's what I want like parents to just know is like, if you're like, I think something's off, give us a call. That doesn't mean that something is wrong. It doesn't mean that your child may or may not need therapy. But I think to have that conversation to say, oh, yeah, this is just age appropriate development. Or, I think maybe there is something that the child's having a little bit of a harder time adapting or managing, or regulating their emotions or showing their emotions. That if we can work with that early on, it makes a huge change in their trajectory. And so, yes, all of the work is done with parents, right? Like, no, I will not see a 2-year-old by themselves. I will not see a baby by themselves. It's all with the work with the parents in the room. And so it could be one parent, it could be both parents. If there's two, a caregiver. Um,
Yeah. Yeah. So it sounds like really it's that relational lens and then the focus on regulation and understanding and connecting with that baby or infant or toddler. And just, with my experience of having 4 kids, I feel like, I could have read all I could, right? We can read it all we can. But when you are seeing the differences in temperament from the beginning, right? And you have a lot of experience seeing those differences, how do we as parents then adapt, right? And that's really what it sounds like what that experience is like. Yeah.
Yeah, and you bring up a really good point. Something that, is this idea of like we call it goodness of fit. Whereas what is the child's temperament a good fit for the family, right? Or the parents. So, right, I think most parents when they are expecting a baby or wanting to adopt a baby that they're hoping, right, that there'll be similarities in their personality, right? Like, well, when I was a toddler, when I was a kid, I was a really good kid, right? I was a rule follower, all the things, right? Didn't cause any problems, which I
That's
would
what I
actually say,
believed, Laurie.
yeah,
That's what I believe.
same, 100%, 100%. I like we're laughing, but I do think there's moments where I'm sometimes like, is that good, right?
Yeah,
Like, sometimes when it's the quiet good kid, it's like, is there something else going on? Uh,
totally.
where maybe they're not able to hear, right? Like a hearing deficit or a learning where like so yes. But let's just right, like we with the goodness of fit that sometimes, right, a child is born, or especially with adoption or foster care, oftentimes even more so, right, when there's not the DNA piece, the biological piece, that oftentimes the baby or the child doesn't feel like a good fit. And I put that in quotations because it doesn't mean that you don't love them. It doesn't mean that you don't love them as your own child, right? But I think if there's not that goodness of fit, it makes it really, really, really hard for the parent because you're exhausted. Because you're like, I don't know, what am I doing wrong? It can come into like parents feeling like they're failures. It can feel like parents aren't doing enough. They're doing something wrong, right? Their approach worked for one child and now isn't working for the second or the third. And so what is it? And it can really lead to a lot of self-esteem. It can lead to a lot of marriage challenges. I work with a lot of parents where sometimes, they have disagreement on how to parent this really difficult child that maybe doesn't seem to be like either of them. And so there's like, what do I do? And so it can play a toll on the marriage. It can play a toll on your just self-worth, your worth as a parent, what that means. And so when that is happening, like the kid picks up on that. And so that is an added layer. And so that's why I love working with parents. I love working with the family system together because I think learning how to navigate those really difficult dynamics. Yeah, I've seen some beautiful, beautiful things happen by just them learning to see things and understand each other better.
Yeah, and I think part of that, right? I mean, a couple things from what you said stood out, but that idea of the fit, that is a constantly, I know we're kind of joking around, but it is a joke in my
Yeah.
house, sure, of like, what would my ideal scenario be? It'd be all of us sitting and reading,
Yeah.
snuggled in bed together.
Uh-huh.
None
Uh-huh.
of them want to do that.
Yeah.
One of them wants to be like on my elliptical while reading while spinning something, and it goes to show how much energy though something like having those differences can really be. And, with having a couple of kids too on how those differences affect one
Mhm.
another too. If one of your kids might struggle with not being able to regulate themselves, how do they actually do that with a sibling? And how do they do that with a parent or like maybe there's a consequence of some sort and
Mhm.
one kid handles it like or how it would appear to be of like, okay,
Mhm.
I can't have this anymore. And then your second is like, I can't have this anymore and freaks out,
Mhm. Yeah.
right? And then what do you do as a parent? Because we're taught not to freak out, but oftentimes we have a difficult time too regulating ourselves when our kids are not regulated. So I think having some assistance on like how to do that and also just seeing how that can affect your kid in
Yeah.
positive and negative ways.
Yeah. Yeah. And you brought up an infant mental health term that we talk about a lot is parallel process. And so it's kind of this idea of we treat others how we want others to treat others. And so, but it comes from this kind of top-down model where the person, and so it can be aged, but it's not always aged depending on the system that we're talking about. But let's say in a family system, right? How the grandparents treat the parents is how the parents will treat the children, right? So that also goes into generational things. We tend to parent how we are parented, or we like learn like I'm not going to parent like that, but it influences how we parent our children. But it's kind of this idea that if mom isn't well or if dad isn't well, it's going to be really, really hard to parent well.
Yeah.
And so it's kind of how we, are treated is how we will treat others. Um, and how we are treated in our like ability to manage and regulate ourselves is how we pass it on, right? But then on top of that, with little kids, they are noticing so much and affect and noticing tones of voice. And they're picking up on all of these nonverbal cues that we think, oh, they're just a baby, or oh, they didn't hear that, or they don't understand. But babies and kids are so good at picking up feelings. And if they aren't able to express their feelings, right, through crying or being attended or being responded right, then their anxiety can increase. And yes, like babies can be very anxious and toddlers can be anxious. And so that goes into like that back to that family system approach and that kind of that parallel process of why I work so much with the parents. Because if we start at the bottom, right, with the kids, it doesn't go back. It doesn't go the opposite way. I mean, obviously, right, how your kid is can influence your mood for the day, of course, but it's not quite the same.
Right.
It's not the same. It's not.
Right. It is that I feel like is a point to highlight, right? Because a lot of us now are more and more aware of what has affected us from the generation before and the generation before that, and how that all trickles down. And to be able to, at the beginning or roughly the beginning, to be able to help your child change the course of the next generation and next generation. It feels big, right? But big
Yeah.
in a good way,
Yeah.
you know,
Yeah.
where there's so much that can be
Yeah.
done right now to
Yeah.
help their future self. It's
Mhm.
that foundation. It's
Yeah.
very cool.
Yeah. And I think the thing that I, bring home is that it can feel really overwhelming. It can feel like a lot. It's like I have this control to change this next generation, and it can feel like pressure. And we talk a lot about like good enough
Yeah.
and what is good enough parenting. And, um, statistically, good enough parenting is 60%, which feels like you're failing, right? 60% in school is a D. It's almost failing. Um, and yet in parenting, if you are consistently now like not taking into account like abuse and trauma and like really catastrophic things that can happen, life altering events in that sense, but just like consistency in parenting, if you are consistent 60% of the time at responding positively, that is actually enough. And most parents that I see are probably in the like 95 to 100, right, like range. And I would actually say that that can be detrimental because then the child doesn't learn self-regulation skills. They don't learn to self-soothe if you are 100% of the time responding instantly. So I think we talk about that, right? That's very complex. And I don't know that my examples in our conversation just now in a couple of minutes maybe make it that much sense. But I think in our office, we can talk more about your specific situation and what good enough means and what that consistency looks like and if it's the right kind of consistency, right? Like kids need routine, they need consistency. They need to know what expectations are, what to expect. And when that is changing all the time, that is really exhausting for kids.
Right.
It's exhausting for adults, right? Like I don't like it when stuff just changes. And I'm a pretty stable adult, I would say,
Right.
all things considered. And so for a little kid who has less of those skills just naturally built in, that they're learning, that's really, really hard. And so what does that look like? Another area that I work a lot with that kind of goes into this complexity is I do see a lot of families in high conflict family situations. And so where it's maybe a high conflict divorce or just an abusive relationship where there's a child. And so I'll see the kid, and that is an extra layer of consistency where maybe when they're at one parent's house, it's very different rules and expectations than the other parent's house. And so, how can we stay 60% consistent? And I say, it's not necessarily consistent across like their life, but it's about like each person, right? So if dad does a certain thing 60% of the time, they are making that connection with that parent. They know the difference between parents
Yeah.
or caregivers. And so it's like working with the individual on consistency. So it's not, I need to make sure that my ex is doing what I'm doing to stay maintain consistency. Like that's ideal if that can happen, but I understand that's not always realistic or possible, but that doesn't mean that's they still can't be effective parents.
Right, right. I love that. And two things you said that I was thinking, yes, this is great. Kind of backing up when you talked about, right, that good enough parenting, and even just taking in the fact that being like 100% on point all the time would actually be detrimental for the kid, because then they're not building resilience. They're not learning to regulate. And so I think that's a good thing for all parents to really just take in, because I think we're really, like, a lot of us are just really hard on ourselves,
Yeah.
and
Yeah.
expecting us to be like nonstop
Mhm,
awesome,
mhm, mhm.
constantly. And it's not realistic. And to put it
Mhm.
in the perspective like you did, of that might not even be a good thing ultimately
Yeah,
to do that, I think it really helps.
yeah.
And also with the co-parenting, that's another thing that I see can be really difficult, which is 2 homes, 2 different sets of rules, and a lot of times each parent is probably not gonna be a fan of everything that the
Right.
other parent is gonna do. And I think hearing that, it's gotta relieve some just of that anxiety about that
Mhm.
situation, of you really just have to focus on what you can do. I mean, obviously there can be more things,
Yeah,
but kinda going
yeah,
into that,
yeah.
keeping your side of the road as clean as possible and being
Mhm.
consistent
Yeah,
matters more
yeah,
than some of
yeah,
the other things that might show up.
yeah, yeah.
So, I wanna hear a little bit about, I mean, you already said some of the things that makes your work different with the kids, right? Working with the families and working with young kids and in high conflict divorces or separation. Are there other things that somebody would say, yes, this is what makes Laurie different, besides, when I'm at the office and hear the kids running in excitement to come see you?
I know.
That is the best.
Yeah. Oh, the first part of therapy is really just forming that connection and that trust and building that. So I think I try to have fun. I try to have a lot of fun with the kids. And so we do a lot of play. I do sand tray, and that can be so much fun to come up with different worlds in the sand where we create, add different, they're basically toys, but like little figures like into the sand to create worlds. Mom and dad are definitely part of that, or parents or siblings even can be part of that depending on their age. And building these worlds together and kind of working through challenging situations together through the sand. So my focus is very much play, right? So kids' language is play. So that's why. If parents are like, well, play therapy, right? That's just like a glorified babysitter. That's not true, right? It's how the kid is communicating. And so that's how they explore the world, that's how they explore scenarios. How they play is kind of their internal dialogue in a lot of ways, or they're mimicking things that they've seen, whether from a show, from real life, from school, siblings, peers, all of that. The other thing that, yeah, so in my office, I have a sensory swing. And I think that's something else that kind of sets me apart a little bit, is just my knowledge and interest in sensory regulation and sensory integration of things. So no matter kind of what is going on, I've found that if we are meeting the sensory needs, right, then we are able to have a conversation or process the emotional challenges that are happening. Yes, my sensory swing is super fun for a little bit older kids. And yeah, it can be they can just like climb inside and it's super cozy. It's like a little nest. I don't know. And
Yeah.
so that and it also gives me a lot of information about how do they use the swing? Is do they twirl? Do they like it to be moving? Do they like it to be calm? And so that is something where sometimes it leads into conversation with the parents of like, do you notice how your child has regulated? What are some things that we could integrate into their daily life? And it gives me information about how they're processing the world and if they need that much input, right, from the sensory swing or from movement, right? Is that hindering them from being able to regulate themselves emotionally?
Well, that makes so much
So
sense.
that is something.
Yeah.
Yeah, if I could be like an OTA and a therapist and not have to go to school for a million years, I totally would.
Yeah, that is so cool, and yeah, your swing is amazing.
And so that leads right to conversations about school, the environment. Is a kid overstimulated? Are there things that can happen at school to do we need a 504 plan or an IEP to help, make sure accommodations last over school different grade levels. Yeah, so there's just a lot of information too that we learn about their sensory needs and how that affects their emotional needs. So, yeah, so that is something else that I do that can be really fun and just kind of help, I think, in the more holistic approach and kind of just noticing, hearing what the child is showing us and what they're telling us, what they're doing is kind of how we work with even really little kids is, what are their movements, what's their actions showing us about how they calm down.
Yeah, yeah. I love the
Yeah.
holistic approach and having the family involved and whatever that looks like, right? Like you said, it could be one parent, it could be both, it could be a guardian, could be caretaker, could be grandma, could be whomever, is that
Yeah.
person
Yeah.
for the kiddo, could be
Yeah.
siblings.
Yeah.
I know we've often
Yeah.
talked about twins where my twins are like this and, talking about that
Mhm.
the co-regulation, that was when they were really young, they really needed each other.
Yeah.
I was like, "Who cares
Mhm.
about mom? Where's my brother?"
Yeah. Yeah. They just have each other.
Yeah.
Yeah.
I'm like, "Hmm."
Exactly. Exactly.
But yeah, so
Yeah, and I think
helpful.
that is a question. I'll get questions about what do you do with an infant, right? How can you do therapy with an infant? And I think, right, I think with that is, if a parent comes in, if they're, have postpartum anxiety, postpartum depression, any kind of perinatal, challenge, maybe the birth was traumatic, maybe the parent is in an abusive relationship, right? And so there's a lot of things that a parent can project onto their child. It could be where, um my partner is abusive and so my baby just was moving and it looked like they were going to hit me and so therefore my baby hates me when that's true at all, right? But there can be those types of connections made and so then that changes how I'll treat the baby. So that's one example of like a pretty extreme example, but that could be like what would happen. And so it's really working with the parent and child together and noticing what the baby is telling us. And so too, right, if a baby was in the NICU for a long time, if they were multiple, right, and or they needed the extra time away from parents after birth, or if there was adoption at birth, right, or foster care at birth. Those are all really good times, right, to seek out services. So sometimes it goes very seamlessly and it's very beautiful and there's no challenges, but other times forming that connection can be really challenging. Or I know people that, say like I love my adopted child, but it is harder to love them because their behaviors are different than my biological children and I don't want them to know that I feel that way. And so, like, right, there's different challenges with that piece too. So I do have a lot of time, a lot of my experience has been with adoption, foster care. So it is definitely still an approach that I have and some experience that I have bring into this family system.
Yeah.
And so yeah, so infant mental health is really working in those situations is when it's really helpful. Um,
So, Laurie, so many wonderful things that you're doing with kiddos and families, and again, giving that foundation and helping parents when there are situations like you said where maybe a kiddo's in a NICU, or there's concerns because there's twins or multiples or adoption, or that there's anything showing up that might be difficult, especially can be at the beginning, but it can be, throughout
Yeah,
those years, right? And being able to address it right away make a huge difference for what
yeah,
comes next.
yeah.
And and you'll be able to help somebody when they come in see if it's something that makes sense for them. And
Mhm.
that could be one session, a couple sessions,
Right.
could be longer, but
Yeah.
if somebody is at all
Mhm.
concerned or
Yeah.
feeling dysregulated themselves as a parent, to reach out
Yeah.
to you. I think that,
Yeah.
yeah,
100%. And my approach is that I don't ever wanna waste your time, money, or energy.
yeah,
So, I'm not one to just keep you on my schedule just to say hi and charge
yeah,
you. So if you come in or you call and there's not a lot of goals, or it's really just, "Hey, I'm not sure if I'm bonding with my baby. Can we do a couple of sessions?" Percent. That
yeah,
can be so valuable. That doesn't mean you're gonna be necessarily in session for years. But I think sometimes forming that therapeutic connection, um, now can also be helpful for when the child gets older and there are things that it's like, okay, we already met this person. We know what this is like. Working with her, that can be really valuable to just know when those hard times hit to then be like, and I have to find a therapist. That
right,
feels really hard. And so I see it more as, precautionary and not so much like waiting till it's urgent and then
right,
having to navigate that system too. I'm always open for a phone call for a 1 or 2 sessions. And then if we decide to move forward and do more, absolutely. I do very long-term
yeah,
care and treatment planning, but I think knowing that I'm available for those quick moments too. So please reach out.
yeah,
I would love to talk with you. And thank you so much, Lori, for having me and
yes,
for letting me talk about the clients that I'm so passionate about and love so much.
I know. And I love talking to you about it. It definitely shines from within you of your care and dedication to those kiddos and their families. So I appreciate you, Laurie, and thanks so much for being here.
Yes,
All
thank
right.
you.